A week ago, 21 pupils from a separate school, this time in Verena, they were also hospitalized after allegedly eating snacks that they had bought from a local tuck shop, at least at that time. Nonhlanhla Ntshingila is watching that leg of our big focus this morning. She joins us now live. And Nonhlanhla, have there been any kind of update around how these pupils are doing, given the time that's passed since they were hospitalized?
It's a very good morning to you, Ayanda. We'll be joined by the Deputy Director of the Environmental Health Services in Mpumalanga, who's going to give us further details as to how are the learners doing and also what are the results of the sample of the asha that they took. You would remember that last week just over 30 learners were took to Mpumalanga Hospital after consuming asha that was sold by a lady who happens to be a street vendor and also one of the SGB members. But for now, I'll be joined by Zithelo Zikalala, who will tell us more about what happened after we left this place. Mr. Zikalala, can you please tell us what happened after we left the school? Because we were told that the Department of Health, they've taken the samples of the asha. What are the results of that asha?
Good morning to you and also good morning to the viewers at home. As the Department of Health, we came on the day after activating our sub-district outbreak response team. A team of environmental health practitioners from our municipal health services in Kangala, they actually took samples of the asha itself. They also took samples of the peri-peri sauce and also the peri-peri spice, and they also, as a matter of safety, they took also water samples from the school. The results were taken to the laboratory as always, and we are going to be reporting that the sample results are not yet out, but we are expecting them sooner. We were in contact with the CDC coordinator from the district here in Kangala, and they are promising that they were told that the results will be out soon. So immediately when the results will be out, we'll be then taking the necessary interventions.
What is the department doing to ensure that the learners and the educators and also parents learn more about food safety, because we can see that this thing is now becoming out of control?
Definitely. We have, as a department, we will embark on a health education drive using the platforms that are available. The SGB, with the parents, when they have parents' meetings, the SGB must convene that meeting so that we arrange that environmental health and all the team members, the CDC, they come over to conduct education, particularly on health and hygiene issues, the wash issues, which is paramount in terms of hygiene practices. We also will be targeting also the vendors around here that are selling, so that we educate them of the importance of making sure that what they sell to the kids is up to standard. We have learned that the peri-peri sauce was the key thing, but that will be confirmed by the results. We also have our outbreak response teams that will be going in the public arena to address communities. You know, every platform that is there needs to be used to address communities and teach them about food safety issues. Also, not to just go around and buy food without washing that food, whatever it is, because even the containers of the other food products that are involved in this outbreak, they need to be cleaned from outside, because they might be contaminated from outside, you know. So it is very important that we teach them the washing of hands before use of the toilet and also after, and also generally practicing good hygiene, including sanitation, because some of the pathogens are coming from vectors that comes from the waste that is heaping is actually heaps of waste that we see around our communities. So we need to make sure that we teach communities as well to be able to handle their waste properly.
Are there any other agencies that you're working with to combat the situation that we're dealing with?
Yes, definitely. As the police official spoke before me here, we've got what we call the provincial joint. It's a provincial organ that is responsible to coordinate all emergencies. So it was directed by the Net Joint, and it met on Tuesday, the 22nd. So that is the beginning of the operations that will be taking place. We also work with our municipal health services, which is the district municipality. We also work with the police, as I've said. Yeah, so we are working as a team.
Thank you so much, Mr. Zikalala. That was Mr. Zikalala explaining to us that they haven't found the results as in yet, but as soon as they get the results, they will update us and we will update the viewers at home. For now, it's back to you in studio.
All right, Nonhlanhla Ntshingila, live to us there from Verena. Thanks very much indeed.